It was widely reported in early August that a review of the evidence in favor of flossing didn't validate the benefits in terms of reducing gum disease. Now, your dental patients are going to read, they're going to hear the news, and for some of them, the effects will go well beyond whether it's a floss or not. And when we come back, I'll tell you why this could be bad news for your practice. Thanks for tuning in to the Patient Attraction Podcast. I'm Colin, receiver. Evidence review in August found inconclusive proof for the effectiveness of flossing in preventing gum disease. Now, that's bad news for your patients because a lot of people don't need much reason to avoid doing something that they already don't want to do already. The review did find that professional flossing for 5 days did show a statistically significant benefit, a reduction in interproximal cavities. Now, the benefit of professional flossing didn't show at 3 and 6 months, though. How many of your patients will take this news as a reason to neglect their teeth? And as proof, when it comes to their teeth, they should disregard anything that dentists say? There's been this strong anti-science tendency emerging in the last decade in the United States. Now, you can see that in the vaccine debate, the global warming debate, the GMO debate, and even in the amalgam filling debate. There's a growing mistrust of authority figures, whether they're scientists or politicians or medical professionals, and the so-called halo effect has a lot to do with that. That's where the perception of someone's physical attractiveness or the value of their service or product or research colors their entire perception of that person. Now, for the science deniers, if the science looks bad, then the people associated with the science must be bad. That attitude is what the dental floss debate will fuel among a certain section of the population. Now, there hasn't been any studies so far that link science denial with a reluctance to get dental care, but the evidence is glaring when it comes to medical care. How will you address the debate about flossing? Now, fortunately, flossing is a very low-risk, high-reward proposition with very little downside and potentially high upside. What the review did show is that there is not sufficient evidence for flossing to claim effectiveness, but your experience and that of your hygiene is also evidence. The effectiveness of flossing is dependent upon your technique, and that's what you need to stress in your practice. That's the evidence that you need to present to your patients and to your prospects. Join me for tomorrow's podcast. Until then, keep moving forward.